Welcome to our Joint Pain Relief, the Power of Regenerative Medicine workshop. Now, this workshop is for you if you are open to the idea that you do not have to live the rest of your life in joint pain. All right. This is also for you if you're ready to trade in your pain pills for a pickleball paddle. And I want you just to imagine for a moment, what if you woke up tomorrow and your joint pain magically disappeared? What would life look like? What would you do that you're currently not doing right now? What would change in your life? The power of regenerative medicine is here, and it's something that's become quite a buzzword in the healthcare field. And so it's important, before we go any further, to define what regenerative medicine is so we're all on the same page. This is from Mayo Clinic Center for Regenerative Therapeutics, and they say, regenerative medicine is, quote, treatments to heal tissues and organs and restore function lost due to aging, disease, damage, or defects. The human body has the natural ability to heal itself in many ways. So in summary, regenerative medicine is all about helping the body be able to heal in more natural ways, creating the right environment in which your body can heal from different ailments. It's pretty amazing. And today we're going to be talking more about what does that look like in regards to joint pain. Now, you've all experienced the power of regenerative medicine in your life in some form or another. By a show of hands, how many of you have ever cut your hand and had to have stitches? Okay, I saw you raise your hand over here. Which part of your hand did you cut? Your finger? Is it still bleeding right now? It healed itself. Now, how long did you have to go to school to learn how to heal the cut finger? God did it, right? There's an expression in healthcare that we use, and it's called the power that made the body heals the body. The power that made the body heals the body, right? You don't have to go to school. It's just naturally. You seal it up. If it's bad, you may need stitches. If it's not too bad, you put a Band-Aid over it, and magically it heals without any formal education. Pretty gosh darn amazing. How many of you have ever broken a bone before? Any broken bones? Okay, I saw a hand up here. Which bone did you break? Your ankle. Is it still broken? Okay, so it needed surgery because it's a little more severe in nature. So how long did you have to go to school to learn how to heal a broken bone? You did? Got it, right? And the same thing happened when my son broke two of the bones in his arm a couple years ago. He had to have surgery as well because it was displaced pretty significant. So the surgeon said, look, I'm going to go in there, I'm going to put a bracket. My job is I'm just going to put the bones close enough together. But he said, I'm not healing you. My job as a surgeon is just put the bones close enough together. The magic is in the body. So again, that is regenerative medicine, creating the right environment where a body can heal, whether it's cut skin, broken bones, or today we're going to be talking about joint pain. Now, any botanists, any master gardeners in the class we have today? So you may have a plant that looks like this at your house at some time in your life. So focus on the before here. If this plant was dying, it's not dead, but it's dying, what would be a few essential things that that plant would need to be able to be restored to a healthier state? Water. What else? Nutrients and sun. Can we all agree that if there is a proper balance of water, nutrients, and sun, that a plant could go from this before picture to a healthy and vibrant state? Have we all experienced or seen that before? Now, what happens if you give it 99% sun and you starve it of water? Do you get the same result? Right? What if you give it 99% water but don't give it any sunlight? Do you get the same result? You see, there's a wisdom and order and a proper balance of the sunlight, the nutrients, right, the water that has to be in place. And when you can give it in the proper order, in the proper ratios, we know that the plant can heal. So the same principles apply to the human body, right? There are different elements that must be in place. So today we're going to be talking about the 3 steps to joint regeneration. The 3 steps to joint regeneration. Step number 1, neurological. Step number 2, metabolic. And step number 3, structural. And we're going to dive deeper into each of these. Let's start with neurological. You don't have a knee problem, you have a brain and nerve problem. You don't have a knee problem or a hip problem, you have a brain and a nerve problem. This is one of the most common errors I see is people look to the joint first before they look to the brain and nerve, and as a result, they get frustrated. Now I see some eyes going, well, what the heck does that mean? So let's go more into that. The condition specifically we're talking about is known as arthrogenic inhibition. It's a medical term, arthrogenic inhibition. And what they have found that after an injury occurs, and you fall, you twist your knee, even after surgery, right, or after repetitive traumas, right, that can lead to arthritis or degeneration, quote, it's an ongoing reflex reaction of the musculature surrounding a joint after distension or damage to the structures of the joint. Now, here's the important thing. Here's what happens after an injury or after surgery. You get muscle weakness, you get muscle atrophy, and you get joint instability. All right, we call it the trio. Muscle weakness, muscle atrophy, and joint stability. And what happens, your body then thinks that is the new normal. It becomes hardwired. Now, how many of you have ever lived by a railroad track? Okay. So I had that same experience when my wife and I, we just got out of school, and I went to work for a doctor up in Northern California because he had some specialty training and certifications that I wanted to learn from him. So we packed up our car from Texas and drove our little Honda Civic with an infant and a pregnant wife of about 3 months up to Northern California. And the house that we found for rent was about 100 yards from the railroad tracks. The first week, we couldn't sleep. Right? All we could hear is that train, and it would rattle the house, it would rattle the windows. But what happened after a few weeks? Right? We didn't hear the train anymore. People would come over, they'd come visit us, and they'd be like, how do you sleep with this train? How can you even focus and have a conversation? And we would say, what train? What happened? Did the train change, or did our ears and our body become accustomed to it? See, that's what happens with arthrogenic inhibition. Your brain becomes used to the muscle weakness, the muscle atrophy, the joint instability, and now it thinks it's the new normal. It becomes the new normal. And if you have that trio of muscle weakness, muscle atrophy, and joint instability, what do you think will happen in the months and years ahead? Everything's thrown off, and it creates further problems. That's why someone, I twisted my ankle back in high school, and it always twists. I hurt my knee, and on, right? Because it becomes normal. It creates an environment for additional injuries and arthritic conditions to occur. Now, we're going to just go into a little bit of science, so hold on with me just for a moment. The first one to talk about is reciprocal inhibition. And this is one of the things that happens after an injury. What that simply means is, so I'm holding this cup of water, right? For me to hold this cup of water, my bicep had to tighten up, right? But what happens to my tricep? See how it's just flabby. My tricep had to let go. If my tricep didn't let go, I would never be able to drink a glass of water or feed myself. So our body has a neurologic connection that when one muscle contracts, the opposing muscle relaxes. We don't have to tell it to do so. We don't have to go to school to learn how to do that. It's just something that our body was created to know, and that's called reciprocal inhibition. They've identified that when an injury occurs, the reciprocal inhibition kicks in. Specifically in the knee joint, they have found that the hamstrings will tighten up and the quads become weaker. The hamstrings tighten up and the quads become weaker after an injury. And again, that can last for months, even years. That's why some people say, they'll come and say, Doc, I can't straighten out my knee, right? Because their hamstrings are so tight, they're holding on, and their quads are weak, they can't fully extend it. It's a neurologic condition. The other one I want to talk about is called autogenic inhibition. Now, what that means is, let's pretend that this table right here, that it weighed 1,000 pounds. And if I was trying to lift this table, right, I'm not that strong, I couldn't lift it. Eventually, two things would happen. Either I tear my bicep muscles and the muscles in my back, or my muscles just give out. Which one most commonly occurs? Your muscles give out. Because your brain has these receptors. Actually, the muscle has these receptors that says there's too much tension in the muscle, and we are going to tear and damage the muscle and tendon, and we don't want that to happen. So it sends a nerve message that causes the muscle to relax. I have a friend who's maybe 10 years older than me, and he sent me a video recently. He was in the gym working out doing squats, right? And the squat rack, and he was trying to do a little heavier than he should, and he was recording himself, and as he was going for the last couple of repetitions, his body gave out and he just collapsed to the ground. Now, he had the bar there, so he didn't get compressed by the weight, but what happened was autogenic inhibition. His body knew that, hey, there's too much pressure on the joints of your body, and so the muscle said, turn off, and the power turned off. So these two conditions that I just described, that's what happens neurologically, and it creates that imbalance where now you have muscle weakness, muscle atrophy, joint instability that creates further problems in the joint itself. Now, here's the really cool thing. Because we understand how these neurologic pathways work, we have the ability to turn the power back on, as I call it. So you have different muscle spindles, right, in each of the bellies of your muscle. And think of like a dimmer switch. When these muscles give out, by the way, they don't stay because someone's like, well, I can walk. So it's not like you've lost 100% power. Think of a dimmer switch in a dining room. All right, if it's 100% full, the lights are bright. But what happens after these two conditions I just described post-injury is it's may lose 20%, maybe 40, maybe 60. So now that muscle can only fire and neurologically function at maybe 40 or 50%. And that's what creates the imbalance in the condition for the joint instability. The really cool thing is by learning this, there's been several patients that have come into our clinic, and for the knees, for example, I'll say, all right, well, let's see how those knees are working. And I'll ask them to squat, and they'll do something like this, and they go down and a little shaky, right? They get to about there, and that's it, and then they'll slowly come back up. Without doing anything, without a joint injection, without any adjustment, only with working on the nervous system, specifically helping to turn the muscles back on, right? Within a few minutes, we can get them to go, right? And so, again, many patients don't have a knee problem. You have a brain and a nerve problem. So first and foremost, you must fix the neurology of the knee and the surrounding musculature before you do anything else. That's step one to regenerative medicine and joint pain. Step two is what we call metabolic, which simply means there's several chemical processes inside your body. And your metabolic health is directly connected to your ability to heal and grow new and healthy tissue. After you injure a tissue, right, your ability to heal and recover is based on metabolically how healthy you are. Some of you may remember from biology or biochem days, right, the Krebs cycle, right? And there's lots of chemical processes in which our body utilizes to take food that we consume into usable forms of energy. This is just one of several processes, chemical processes in the body. But our body, almost think like a dashboard, right? Our body has 5 key indicators which help us identify how metabolically healthy we are. And those 5 key indicators are like the gas gauge on your car, right? The temperature gauge, the oil pressure gauge, right? There's just a few gauges on the dashboard, but there's many functions and things that require a car to be able to function properly. But by a few key indicators, it can tell us what's happening inside. So metabolically, we look at waist circumference, specifically waist to hip ratio, number 1. Number 2, your blood pressure. 3, triglycerides. 4, cholesterol level. And 5, your fasting glucose level. And by the way, these last 4, to be metabolically healthy, need to be in a healthy range without medication. I have some patients that come and they'll be like, no, I'm metabolically, I'm pretty healthy. My blood sugar's fine. No blood pressure, no problem, right? Cholesterol, no issues. But then when we pull their chart and read their medical history, they're on blood pressure medication, cholesterol medication. So I said, well, what happened if you didn't take that medication? They said, oh, my levels are through the roof, right? So it gives them a false sense of being metabolically healthy, right? So again, these last 4 need to be within a healthy range without medication. Now, when you're metabolically unfit, it creates a state of inflammation in the body, inflammation. And when your body is inflamed, we know that is connected to almost every known health condition. Inflammation negatively impacts and contributes to, whether it's cancer, cardiovascular disease, Alzheimer's, diabetes, arthritis, autoimmune, neurological, pulmonary, and the list goes on and on and on. But bottom line, when your body is in a state of chronic inflammation, it has a very difficult time healing your joint pain, healing the ligaments, the tendons, the muscles that are involved in there. Y'all with me so far? Okay. Now, here's a simple measurement that you can actually write down and do when you get home, right? So I want you to look at the mannequin. When we look at the waist to hip ratio, your waist is going to be around the belly button. So it's the most narrow spot, right? For some people, the belly button, so maybe a little bit above it. So you're going to measure that in centimeters. And then you're going to measure the hips. It's the widest part. Your hips are down here. You're going to measure at the level of the hips, right? In a simple math equation, you're going to do waist in centimeters divided by your hips in centimeters. Right? And if you look at the chart over here, it tells us the different parameters. So if you're a female, if it is 0.85 or higher, that is a high risk, meaning metabolically you're at a high risk. You're not in a great metabolic health. If it's 0.8 or lower, it means, all right, low risk, doing pretty well. For the men in the room, if it's higher than 1, you're at a high risk. If it's 0.95 or lower, you have a low health risk. Simple test that you can do at home to assess your metabolic health. So for the ratios, so for the women, your target is 0.80 or lower. 0.80 or lower. If you're 0.85 or above, that's red, danger zone. So we're going to take the waist and we're going to divide it by the hips. So it's called the waist-hip ratio. Waist divided by hips in centimeters. Now, here's the question for you. What percent of adults in the United States of America do you think are considered metabolically healthy? Let's take some guesses. It's a single digit? Okay, so a low number. 10%? Okay, you guys are pretty close. 12%. This is from the University of North Carolina School of Global Public Health. That means there's 88% of Americans that are metabolically unfit. Right? Yeah. So Dr. Caldwell, do you think that number has improved or probably decreased? Yeah. So the 8 and 10% may actually be right on. Right? That may actually be right on. So the large majority of Americans were not metabolically healthy. We have a hard time healing. And we have chronic joint pain along with other health issues. One of the patients came to see us. This was maybe about a year ago. And they came and saw one of the other providers in the clinic. But I was reviewing the x-rays with them. I said, well, why do we have x-rays of this gentleman's hands, elbows, shoulders, and hips? Right? I was aware of his hips because he'd known he had hip degeneration arthritis from an old injury decades ago. And it was visible on the x-ray. But when we looked at his hands and his elbow and his wrist, there was no signs of degeneration. But he was like, I'm having so much pain. I can barely hold a pen when I'm driving. Right? And this gentleman was in his mid-60s. Right? And so when I looked at his health history, right, and when I met him, it was obvious this man was metabolically unhealthy significantly, right? We got his lab works and it confirmed he was significantly metabolic unhealthy. So I said, look, we don't need to go and do all these injections on you. The first thing we need to do is we need to address the neurology. And for him, a big part was we need to work on getting you metabolically healthier. So within the first 2 weeks of working with his metabolic health, put him on a low inflammation diet, give him some nutritional supplements to help put out the fire of inflammation. He comes back in, he's like, hey, it worked. And it was Monday morning. So what worked? He says, my joint pain's gone. My wrist, my hands, my fingers, my thumbs, my elbows, shoulders, the pain is all gone. Right? And it's something, of course, that we expected to happen. But he's like, I didn't think it would work so fast. Right? I didn't think it would work so fast. But he was just so amazed. Now, here's the interesting part, right? I see him a week later. He says, doc, I messed up. I said, well, what did you do? He said, I was feeling so good that I thought it'd be okay to eat a crumble cookie. Now, have you guys seen the crumble cookies? Okay, Crumble is a brand of cookies, very delicious, but full of sugar. A crumble cookie is about the size of 4 normal cookies, right? There is nothing healthy about it, full of sugar and all the unhealthy ingredients, right? So he's like, I thought I could eat a full crumble cookie. And I said, well, what happened afterward? He says, the pain in my hands and elbows came back, right? You see, for him, we had gotten him just below threshold. 2 weeks didn't cure him, but it had got the inflammation fire to extinguish enough where the pain was starting to reduce. Right? And he got lulled into I guess I can eat more sugar. And then that's when he realized, no, this isn't something you do for a week or two. This is something that it's just a lifestyle, right? Just eating healthier. So again, the 5 aspects: waist circumference, blood pressure, triglycerides, cholesterol, and fasting glucose. So step number 2, metabolically, we must fix the metabolic issues to create the right environment to be able to heal and regenerate the tissue in your body. Step 3, structural. That's where we're looking at the bones, the muscles, the tendons, ligaments, the cartilage alignment. This is actually where most people start. If you notice, I said this is number 3, not number 1. The error that I see a lot of people making, I even made earlier in my career, is we start looking at the muscles, the bones, the ligaments, and tendons without looking at the neurology, without looking at the metabolic health. And as a result, we get frustrated. These are patients say, oh, I went to rehab, but it didn't work. Or I got a cortisone injection in my knee joint, right? It reduced some of the inflammation, but they didn't change anything else, and the pain comes back after a few months, right? So structural is an essential component, but again, it's the third one after we address the neurologic and the metabolic aspect. And so these are things like ligament tears, meniscus tears, cartilage damage, right, which is known as arthritis. Those are the references when I speak of structural health. And so one of the things that we utilize is something called PRP, known as platelet-rich plasma. And that helps with soft tissue repair. That can help with ligament tears, meniscus tears, tendon injuries, muscle injuries. It works really, really well at helping to repair the tears in there. Now, some people say, well, doc, I have a tear, but if it's torn and it's separated, I want you to think if we took a piece of paper, if we ripped it in half and I held it in two hands and they were 6 inches apart, all right, the PRP is not going to be able to bridge that gap. These work great for partial tears, right? Partial ligament tears, meniscus injuries, tendon injuries, and muscle injuries work really, really well. And PRP is a procedure that utilizes your own blood. So when the patient comes in, again, we need to make sure they're metabolically healthy. First, we draw their blood, we spin it down, and we concentrate the platelets, and then we re-inject that back into the damaged tissue. And it helps, utilizing your own cells of your own body concentrated, it helps to heal and repair. I mentioned that my teenage son broke 2 bones in his arms a couple years ago. How long do you think he would heal compared to a 60 or 65-year-old? A lot faster. So think of it this way. When we're younger, our body has the ability to heal and regenerate a whole lot faster, right? So just think of, we have lots of regenerative cells around. When we age, part of the natural process is it takes longer to heal. Our regenerative capacities are still there. It just takes a little bit longer the older we get to heal, right? Not fair, but that's just the way it is, and we've all experienced that. So with the PRP, we draw the blood and we concentrate it, and then we can re-inject it to help give a higher concentration of cells that help regenerate utilizing growth factors and other aspects that are already in your body to accelerate healing at a faster capacity. It's pretty amazing and pretty cool. Now, right now, about 93% of physicians for professional sports, meaning like the NFL, the NBA, MLB, they use PRP to treat their athletes and in private practice. One of the conferences I was at recently, I was able to hear from the team physician for the New York Giants and also a separate one for the Chicago Bulls. And what's really cool is they talked about, yes, we take care of our athletes using this, but they said the athletes are a small percentage of our practice. The majority of their practice is people just like all of us, right? They said we take care of younger children, athletes. We take care of weekend warriors. We take care of middle-aged men and women. We take care of grandmas and grandpas. And they said it works on all of these different types of patients. Right? And so some of the professional athletes who have come out and really endorsed PRP and said, hey, it really helped elongate and save my career. Tiger Woods, Steph Curry, basketball player. If you're a soccer person, you know Ronaldo. If you're a tennis person, you know Rafael, right? So it's just really tremendous to help individuals of any age and any demographic to be able to heal those soft tissues injuries at an accelerated pace. Some of y'all may recognize this. This is Rob Gronkowski, also known as Gronk. Any football fans in here? Right. So he was on the cover of Regenerative Medicine magazine a couple years ago. You'll notice his uniform color. It's not the Patriots, but it was the Tampa Bay Buccaneers. So this was right after he won the Super Bowl. So if you followed his career, you know that as a tight end in the NFL, he is in hundreds, if not thousands of car accidents every single season because they plow, they go after him. Excuse me for a moment. And he had multiple broken bones, multiple injuries. And so he said after a few seasons, like, hey, I've won a few Super Bowls, I'm done. And that season he took off before he teamed back up with Tom Brady and went to Tampa to win the Super Bowl. He talks in the magazine about how regenerative medicine played a key role in helping to heal his tissues. He thought he would never play again. He's like, my body can't handle it. At that time, I think he was in his mid to late 20s. Right? But he credits regenerative medicine as being one of the key aspects to helping to heal and regenerate his tissues to feel strong enough to go play another season. And we know how the story goes. Went to Tampa Bay and they won one more Super Bowl. Now, it's not just professional athletes. It's everyone that can benefit from this. This is one of our patients, and I'll let you hear from his own words, his experience utilizing PRP.
My name is Carl, and I live an hour and 15 minutes away. I decided to have PRP in December of 2019 and had great success with it. I was looking at a possible knee replacement, and so um, I had an Israel trip, a 14-day trip to Israel, and a lot of walking, a lot of hills. And so I came in a month before and had 2 injections before I went to Israel, and had a successful trip to Israel, and my knee did not bother me at all, and I've had a follow-up PRP injection. I consider myself very fortunate that I no longer have knee pain, and hope to continue to be active as long as possible.
So it's pretty cool to be able to help people. And for him, that was his big goal. It was going on the Israel trip. And that was several years ago, and he's done well for several years, right? As you can tell from the picture, metabolically, he was taking care of his health as well. Those other 2 components we discussed, those were in place. Now, the next one I want to talk about when it comes to addressing the structural is something called A2M. For some of you, this may be the most significant message that you hear today if you're struggling with joint pain. This was research that come out in the past couple of years, but they have identified what is causing arthritis and cartilage damage at the cellular level inside the joint. They've identified in certain proteases, they call them MMPs, that they're elevated in both osteoarthritis and rheumatoid arthritis, and their catabolic properties, meaning they're actively eating and destroying type 2 collagen, which is also known as cartilage. So they've identified certain proteases in the joints that are destroying and eating away at the cartilage. I want you to think of your joint like a house. And if you had an inspection on your house and it came back that there were termites, what would be the 2 things that you must do if you have termites in your house? Yeah, first you need to get rid of them. And then second, rebuild it. Yeah, depending on the extent of damage, you'd have to rebuild it. But first, you'd have to get rid of it. You wouldn't rebuild it and leave termites there because then you would just give it more food to eat. And so A2M functions like that. We call these proteases joint termites because they function just like that. They eat away at the cartilage, eat away at the cartilage, eat away at the cartilage. And so A2M, known as alpha 2 macroglobulin, is actually a substance in our own body. As we talked about earlier with the cut skin and the broken bones, our body has the amazing capacity to heal. Regenerative medicine is all about tapping in the body's natural ability to heal. And so A2M has been shown to help significantly with cartilage damage. It can stop cartilage damage at the cellular level by stopping or inhibiting the proteases that eat away at the cartilage. It does great for any joint that has cartilage, knees, hips, and so forth. Again, some of you, again, this may be the most significant message you're hearing this year because perhaps you've been diagnosed with arthritis, right? And the doctor said, we're just going to watch it, and when it gets bad enough, we'll do a total knee replacement or a hip replacement, right? No longer is that the case. It is 2024. Our understanding of the human body and how to apply principles, it improves rapidly every year. It is so amazing. And so A2M is another procedure that we were able to learn and bring into the clinic, and I've just seen some really amazing results utilizing that. And so again, to recap, the 3 steps to joint regeneration are neurologic, metabolic, and structural. The 3 key essential areas to address. And just like sunlight, water, and nutrition help create the right environment to heal the plant and bring it to a healthy and vibrant state, when these 3 areas are addressed in the proper manner, in the proper order, it creates the right environment for your joints to be able to recover, to heal, and for you to enjoy pain-free living once again. I'll share a story, and this is the last one I'll share, and then we'll open up for a Q&A.
My name is Sandy Ray. My initial problem was I came down off of a golf green and my leg bent out from under me. So I went to the orthopedic surgeon and he did, after an x-ray, he said that I needed double knee replacements, both knees. And just go down the hall and sign up with his nurse and they would cut both of my knees off and replace them. That was the initial problem. I was playing golf when my problem initially occurred, but golf is not my main sport. I am a dancer. I've been dancing for 40 years, and I love to dance, and I want to dance, and I was afraid that double knee replacement surgery would keep me from dancing. And that's why I sought out this solution. So immediately after the orthopedic surgeon told me that, I started looking into something else. I didn't know what was available. By that time, I had to wear double knee braces and a cane. Couldn't walk hardly at all. But I discovered this place, this back pain center, and it was highly recommended. I did a little research, and because this center had a 95% success rate, I decided to drive 60 miles to come here because it's the best. But from my initial visit, I was very impressed with the professionalism of all the people at the Back Pain Center. Everyone is so nice and thoughtful and considerate, and you're more than just a number. They actually know who you are. And they knew what my problem was, and they helped me 100%. And I followed the program completely. And now, I mean, it's fabulous. I dance probably 4 nights a week. I teach dancing. Um, I also get on the treadmill every day for 35 minutes. So it's just been a tremendous success for me. But I followed the program. I did everything they said to do, and it was just nothing but total success.
How cool is that? From being told she needed double knee replacement, right? And then she said she just followed the program. The 3 steps I just outlined for you: neurologic, metabolic, structural. And she got amazing results to dancing 4 nights a week, treadmill 30 minutes a day. And again, she's just full of energy, and it's really, really exciting to be able to help patients and be able to see that just day in and day out.